And like, can you imagine how good of drapers we would be? All day, 5-6 clients a day just draping them.
Oh yeah.
It'd be pretty amazing. Okay, so I'm just warming up here. And of course, what is a warm-up? It's just a really fancy palpation experience, right? So what you're doing is assessing tissues, finding out what the heck is going on, right? So now we're gonna get into QL. Alex, can you open that curtain behind you? Just want to make sure I teach you pretty much everything. Okay, might be a little bit out of order, but that's okay. Okay, so I'm just warming up, and I like to move the tissues of the glutes. Are you comfy? Just to get a feel of what's going on, but it helps me to release tension, definitely the QL and the erectors. So on there, sorry Alex, again, right? So you can just pull along the iliac crest on the top and work with it. Go that way, or hook onto the iliac crest, pull it up while you strip down towards the greater trochanter. That usually feels pretty good. Is it okay for you? Oh yeah, you're just getting a workout with all these. It's not as tight as yesterday, which is good. Where does your strength come from as a massage therapist?
Body weight.
Your body weight or the
Floor.
The floor. Good job. Good job. That's exactly where it comes from.
Only because you've said it like 10 times already.
Have I
It's in here
really?
now, it's in here now.
Boom. I love body mechanics. I love sacral edge. And of course, we have our sacrum. I'm sorry, guys, over here. You can come over here. Have our sacrum here. And somewhere in here, we have our SI joint. All you're going to do, follow that iliac crest. I'm on the inferior side of that iliac crest. Does that make sense? I'm not on the top. Somewhere around where the iliac crest is. And all I'm going to do is I'm going to hook my fingers into the sides, one foot behind the other, shoulders down, I'm in alignment, and I'm going to just rest. So I trained as a professional ballet dancer, feeling and seeing, look around, check this room out. What were the fire department guys here for? All of a sudden I walked out and there's this huge fireman, and I was like, whoa, hey. Yeah, they were checking stuff. You guys didn't see that?
They're downstairs too.
Yeah. Oh, okay. I got a little worried for you guys because I'm like, I got people on the table like naked. Like, if we gotta move now. It's kind of funny. Okay, so we're compressing down and through that SI joint, stripping off. Done. What's next on that iliac crest? Correct? Perfect. And then here it's all meaty and nice, right? Usually, how do we treat QL? You do your best. You're like, you know, kind of trying to do whatever. And here, what you're gonna do? Come to the side. Angle your body towards that iliac crest, the attachments, and feel for, if it gets too much, let me know, but we're doing okay, hey?
Oh, yeah, fine.
Feel for that edge of QL and come around. Edge of QL, come on. Now don't get confused, you're gonna feel a few other muscles in there. You have to feel you're gonna feel one bump and then another. The second one is your QL, okay? So I don't wanna see anybody working in here. This is not QL. You're hitting like transverse abdominis in there, you know? We want to be over a lot more. You can get in there. You can sink right in if you want. You okay? You're going to sink in. It's nice to rock a little bit. Get some movement in there. The spinous process of the lumbar, and you're going to pull up. So I'm just going to open my stance really big, and I'm just going to pull up. And across, you good?
Oh, that feels great.
Doesn't it? And then come back down and pull it apart, separate. Come right next to the spinous processes, pull across, good, and separate it open. Rock the pelvis, strip QL, up, call it a day. Sound good? That's some good QL work there, hey? Done. How does it feel?
Great.
I know, it's so good. Okay, did I do good work?
Yeah,
I did good work.
Mm.
Only I'm not being a cocky. Where we're gonna work to about the inferior edge of that scapula, or the inferior board of the scapula, because then it gets kind of crazy in here. Like there's a lot of stuff. I am palpating anything else but like traps and rhomboids through there, right? So we're only going to work in this little area for spine, or for not spine erectors. My nose is really itchy and I don't know why. It's because I'm teaching you guys, and now I'm like, I just want to scratch my face off. Okay, so for erectors, just like we did IT band and peroneals, same sort of thing. What I want you to do, find the spinous processes. So here's the spinous processes here. I'm going to pull up from them and really hook onto the side of longissimus. Does that make sense? So I'm on spinalis with the tips of my fingers, but longissimus is resting on my fingers. Does that make sense? Mm-hmm. And then I'm just going to strip away. You okay? Me, just so you know, on the table, my stance is quite big, and I'll separate. And this, go very slow and be very specific. This isn't what I've seen a lot of, and I've corrected. It's just a lot of people just blowing through it like a strip. This isn't a strip. We're getting to the edges of something, and it's like you're trying to lift and separate. We're creating space between each erector group. Does that make sense to you guys? Mm-hmm. Trying to pull borders away. If you feel like it's really a little sticky, what I'm doing right now is lifting up and through. And then what you can do, let's go to the other side of longissimus. So you see the other side I have, the more medial aspect, and then you may have not of, and it's all good, so don't worry about it. All right, just a little bit. Can you name off some of the scapular muscles? I heard infraspinatus. So infra, supra, subscap. So let's do the last one in that group. Teres minor, right? So we have teres minor. So let's do the other one. Teres major. Let's do a big one. Latissimus dorsi. What else? Rhomboids. What else? Just this one. Hold that thought though. Levator. And then trapezius. In the front.
Pecs.
Pec major, pec minor. We did subscapularis.
Levator.
Levator.
SM.
Nope. Has nothing to do with the scap. I love.
You see my hands are cold.
Okay, so you're cold. Okay. Anybody else cold?
No.
Okay. So I'm just warming up. Superficial muscles, trapezius, right? Trapezius comes from the external occipital protuberance, comes around lateral 1/3 of the clavicle, around the cromerium process, spinous scapula down to T12, right? Nice, big muscle. In our brains, it's huge. In reality, it's like so small, right? So we have that. Underneath, we have rhomboids. Rhomboids are from what? The spinous process. Yeah, it's a nice muscle. People love it, whatever. It's actually not that exciting, okay? Let's get down to some other things. So I'm quickly just warming up between the scapulas because that's where I'm gonna work right now. So get used to moving the scapula like this. I'm just rocking it back and forth. It's a little bit of retraction, it's a little bit of depression, but what it lets me get is into the tissues, right? Which is what I wanna do. So we're just warming it up just like that. So for rhomboids mid-trap, you can come from this side. You can retract the scapula, come down, hook right next to the spinous processes, and then pull down if you want to go that way.
Oh, that's so good.
So there's that way.
Feel how ropey that is.
That's your like longissimus, and there we go. Done. I don't like that one as much, but if you like it, good. What happens with a lot of clients, yeah, you got that pillow, it's all, you use it. A lot of clients will start going like this, and this is why scapular mobilizations from the posterior aspect is so nice. Pull them back up. Make sense? If you're working like this, do you see my posture?
Yeah.
I now have to do this. My lower back is gonna start to hurt. I don't want that, I wanna be here. So, you can start with retraction and protraction, just slight rocking of the scapula to get the attachment of the lateral. So nice warm up, mid-trap rhomboids, and that's how I treat those guys. If you wanna get upper trap, it's nice to come up, and you will just do elevation and depression while you're warming up. Come up, you good? Pull through into depression, scoop into the supraspinous fossa to get supraspinatus. Make sense?
Yeah.
We good with this so far?
Would you want to release pecs before doing all this, or?
No. You can if you want. Doesn't matter. Some people love doing pecs first and then doing rhomboids. And that's fine. It's all good to me. Whatever you want to do. Through. Done. Next we have levator. Levator, press into where the root of the spinal scapula is. Turn, take both my hands and compress into that attachment. Are you okay?
Mm-hmm.
And I am doing a little traction, pulling this way at the same time. Now, 2 ways you can do this. You can go from the attachment, being lax, come up towards the transverse processes as you're going into depression of the shoulder and flexion of the neck. Is that okay? So you can work that way, but you have to be specific with your fingers that you're actually on the posterior aspect of the TPs. Do you guys know how to palpate the TPs? Everyone's very comfortable with the TPs. And really work that attachment for levator. Now Sam was like, yesterday we were talking about the cervical region and why would I put them into semi-reclining, because I could do the neck in sideline. I can't do the anterior neck in sideline because I'm just going to take that arm out. It's not stable in here. Makes sense? Do you see that now, Sam? Perfect. So this is also another way to do it. If you do a lot of MVAs, it's nice to put people who are acute, like they just in sideline and treat this way. And you don't even have to go that deep, right? And you don't have to do a lot of mobilizations because a lot of time it's just relaxing them first. But this is a nice way as well. So you can work the TP in there and you can do some really nice cervical work in sideline for posterior. So this is me getting very specific. Just working the TP. You are welcome to pump this if you want. I don't like, for me personally, I don't like this way as much. I like the other way. Try them both. Okay? So it's levator, rhomboids, upper trap. Next, in the front. But just in case, so you feel better.
No, you said pecs and I went, oh God.
Yeah, oh, okay. Get ready for that. It'll be great. There's a few ways to do all these things. However you want to do them is fine. So right now I'm just warming up Terry's, right? Which is quite nice. I can get quite specific if I wanted to and get right on Terry's while I move into extension, right? Because Terry's major is an extender. So right now I'm right on the border in between. Does that feel okay? Okay, lats, you can go all the way up and through to the iliac crest. I'm actually gonna flip and do it this way. You good?
Yep.
Okay, relax your arm. That way. I could do it from the back as well, if you wanted to. Lats mix up the posterior axilla, right? You with me? Pec major. I'm just getting into your armpit now. Just relax. Just pretend I'm not doing any of this.
Just pretend I'm not.
Just pretend I'm not here. Here's pec major. Here's lats. Here is serratus anterior, correct? Find your lats. Palpate through. You can squeeze them if you want. I'm sorry about that. But what you want to do is find the edge of the teres and you can just work them, which is nice. Is that okay? Through. Okay, so that's lats and teres. Yay. What else did I? The elbow, your thumb, and your thumb's gonna go into the armpit. I'm so sorry, Katie. It's like you're holding a hamburger, okay? So you're just gonna breathe, close your eyes, go to like Hawaii. It's gonna be, I won't go hard, okay? I won't go hard at all. I'll do a nice demo. So what you're gonna do, put your little hamburger in, you're gonna push back, and then you're going to lift up and over your thumb and then push into subscapularis. I'll just back right off. with your thumb. Does that make sense? So what sideline is the greatest for subscap? Did that feel okay? I made it. Is that okay? And don't pump, don't go back and forth, don't do anything. Just hold it, release, reposition, and go in again. Make sense? Subscapularis, we're all gonna get a really nice treatment for that, okay? There you go. Pec major, pec minor. So, you're really worried about this. I'm actually really nice. No, I am super nice. Pec minor, right? Big important. No, you yawn away, girl. Live your best life. I get it. So, let's do pec major first, and then we'll go through pec minor. So, what is nice to do is to, so again, I'm scooped under, and all the movements come from my forearm. So she's always draped, even when I'm working back here, she's always draped over my forearm. Somebody once commented about my hand, how weird it looks there. I was like, yeah, because it's comfy. But this hand is actually not doing anything. It's all coming from here. So you can comment and judge my weird hand. I don't care. It's not doing anything. It's just there for my comfort. So what you're gonna do, get in there. Put her humerus kind of in a neutral position, and then just let it hang and fall and strip along the clavicle to warm up an attachment point. We okay? And Sam, if you wanted to do this before rhomboids, go for it. All fine. And I'll make sure you're still covered, okay? Jen, that's my technique.
Yep.
Being nice. Now, what is this muscle a mirror to? You know this answer? Because I told you already yesterday.
Oh, the glutes.
Glutes. Which one?
Mac.
Mean and min.
Oh,
And the fact that they're fans. That's all. Right. They have nothing to do with actions. They're just one big fan, right? So again, they make you okay?
It's like a pin and stretch you're doing right there?
Yeah, pretty much.
Yeah.
But stripping is at the same time.
Oh yeah, so you're grabbing
So it's
it
like I'm
right
like
down.
holding it, pulling, and stripping down.
Okay.
Just combine it all. So warming that. Still okay? Okay, now to massage it. When you move the humerus up, which part of the pecs am I stretching? The bottom, right? The inferior aspect. When it's in the middle, this is how it's the same way as the glute median min. When it's going straight back, that's for the middle. And when I go down, that's more for the anterior. Make sense to you guys? That's why you stretch it on the wall. Nothing moves. Elevate. Open it up. Got it? So that encompasses all actions of the scapula, rhomboids, levator, clavicle. You can play in there as well, right? So you can play in this position or warm things up that way as well. Last thing you're gonna do, we did some good work in there. Come through, push through. Hold,